everybody, Dr. Anjana Vana here, and welcome back to my YouTube channel. Today we are going to be doing an exosome treatment. I know we've done one before, but we were using a serum. Well, a high exosome count, yes, but something that was actually meant to be applied topically, but safe for microneedling. Today we are going to be using this here, the RFM. It's a stem cell conditioned media with an exosome solution. This is meant for microneedling, not for injecting though, but for microneedling in, and it has 27 billion exosomes per ml. So there are 27 billion exosomes in a vial like this. So currently it's not out here. We have to keep it in the fridge, and we're going to be doing it on Sheetal. So all our patients, you can check Sheetal out for the next few weeks and see how her skin is doing. And I had one. Sheetal did one for me on Thursday. So that was 2 days ago. Face, neck, and chest. So that's what we will be doing. But for the purposes of this video, we will be doing Sheetal's face and neck. Afterwards, we'll try and insert a photo. I didn't look that great afterwards. You go very, very, very red. There's quite a lot of stimulation, but it settled down the next day. So no one really could tell what I'd done. Yeah, so we're going to get to it, and I'm going to talk a little bit while we're doing the treatment. So I'm going to disinfect, and then we're going to needle. But the first thing we do before, we're going to needle with something called a glide. So people who do needling, somatologists and doctors out there, the glide is like a hyaluronic acid based, like a microneedlable serum that you can safely put onto the skin. But this glide is also a mitochondrial stimulator. So it's got copper tripeptides, it's got zinc, it's got copper, it's got vitamin B3. Okay, so applying the glide onto Sheetal's skin, and we are going to go in at 0.75. So Sheetal, I usually start with the forehead because it's the most sensitive area. You okay there, Sheetal? So we're opening up channels, these little micro channels for the glide to go in, as well as applying the exosome. So you can, because there's these micro channels open, you can put the exosome straight on, but here we like, going to 0.2, re-needling and applying the exosomes that way. It's nice to do the lids. Sorry, there's this hectic microneedling sound. It's nice to do the lids as well because there's very few things that... Sorry, are you okay, Sheetal? So was that a bit sensitive?
Yeah, but it's fine.
Okay, sorry. That you can put around the eyelids or get into that area. It's got really thin skin, and it gets really crepey, so it's nice that the eyelids are included into a treatment. So I'm drawing this up as is. But if you're doing a bigger area, you can dilute with sterile saline. As I said, this, when you do exosomes, you tend to get exceptionally red, but Sheetal also has a predisposition to go really red, and we are doing a double needling. So just warn your patient, or if you're having this procedure done, please be warned that you can go super red.
So you need to mix it again.
Yeah. So you can just massage it in, but you know, we go into like a 0.2 depth now, which is not very deep. It's still in your upper layer of your epidermis. And the microchannels open to the dermis, like they're still open. So it's getting down there. Okay, comfortable, Sheetal? I think maybe if you scoot a little bit lower. Comfortable?
Yeah.
So we've just completed our exosome treatment for Sheetal. She's under the LED, and I know there's a video on exosomes that we did previously. The link will be in the caption, and up here you can click and you can go to that video. So exosomes have been around for maybe, I think it's about 30 years. It is a little bit controversial. There are other biostimulating products or biologics, PRP, growth factors, your own adipose tissue, like your own fatty tissue, PRF, stem cells, and then what's in this is the stem cell condition media, which is basically what the stem cell secretes. So it secretes MMP1s, where people are like, oh, why is it doing that? Because those actually clear up collagen, but it's clearing up old aged collagen, old age tissue, and then there's other collagen stimulating growth factors in the and cytokines in the SCCM, the stem cell condition media. And then the exosomes, as you know, are little vesicles, are little bubbles of the cell that come off the cell membrane, and in there they've got signaling lipids, they've got micro RNA and mRNA as well. So it's sort of a way to give this, like the tissue, an instruction of what to do. And this is from an exceptionally pure source. They test the donor tissue. There's no diseases. There's no a propensity for cancerous tissue. So it's really, really important, because exosomes are exploding in the aesthetic market. It's becoming very, very, very popular, even though they've been around for 30 years. And you can get non-specific exosomes. They'll sell them over the internet, or they'll sell it in a powder. It's very important that, proper exosomes stay in the fridge. There's a very strict cold chain supply, especially with this. So just be careful. Don't just use something that you see on the internet, or something from some company you've never heard of, because this is, your patient's health and wellness and appearance as well. So in terms of exosomes, it's not like the trash from the cell. A lot of people say it's the trash from the cell, but this is specific for skin. And how it works, like say we take the skin and the effects it has on the skin. So if we think about the skin, it's got immune cells, Langerhans cells. So it regulates the immune system of the skin. It suppresses the immune system. So it's nice for things like eczema, wound healing as well. So it stimulates the fibroblast, so like biostimulation of the fibroblast, and it aims to have scarless healing. There's also the epidermis of the skin, the keratinocyte, so it has an effect there, and also on the blood. So the skin is fed by all the nutrients and oxygen that come via blood vessels. So it also creates angiogenesis, the formation of new blood vessels. So it's an incredible biostimulation. If you'd like to know more about exosomes, you can drop them in the comments down below, because it'll be a long video if I have to cover everything. So please ask your questions, like, share, and subscribe. Thanks for joining me. Bye.